Hi, it's Mike here again with Honest Second Opinion. Today's topic is articular cartilage chondral defects. That's a mouthful. The articular cartilage is the coating on the end of the bone. So in this knee model, it's the shiny stuff on the end of the femur, the top of the tibia, and the back side of the kneecap. The articular cartilage it varies in thickness, but it's really present wherever two bones come together to make a joint. The analogy that I use in the office is somewhat like this lemon. I don't usually have a lemon in the office, but I have one here. The peel or the outer protective layer of this lemon is there to help protect the fruit inside. The articular cartilage coats the end of the bone like the peel of this lemon coats the fruit. The bone itself would be analogous to the fruit inside. So the articular cartilage coats and protects the underlying bone, just like the peel coats and protects the underlying fruit. Now, if I were to peel this lemon, I would take my fingernail or something sharp and I would create a little divot to start to peel the outer coating off. That's exactly what happens in a chondral defect in the knee. There's a divot or a chip, much like when you're golfing, you have a little divot in the ground. That's kind of analogous to the chondral defect on, say, the end of the femur, where there's a piece of cartilage that's knocked off. The surrounding cartilage is healthy, but this piece right here is knocked off. Sometimes it's knocked off completely and can float around inside the joint. The symptoms that go along with that would be varying pain. It may be on the inside of the joint at one point, above the kneecap on the next part of the day, in the back of your knee, and maybe completely free of symptom or asymptomatic. And then the next day or the next step, you feel it gets pinched between the two bones. That's if it's loose and floating around. If it's a little flap in there, maybe attached on one of the four sides, but free on the other three, as you bend and straighten your knee, you may catch that piece of cartilage between the two bones. And that would be have a mechanical symptom or catching or clicking or popping associated with it. Often it's painful. The most consistent symptom that we hear is just an underlying swollen knee that just doesn't feel right. The mechanical symptoms can come and go, but they're not always present. But that low-level pain and swelling in the joint is usually what we hear, and this is often diagnosed on an MRI. The treatment options range from really conservative, just treating the symptoms and trying to get things to calm down, which isn't going to necessarily fix the problem, but some patients do fine with that. And then we go up to more aggressive things like surgical intervention. We can go in with an arthroscope and do several things, actually. The hard part is this articular cartilage has no blood supply, and therefore that's why it doesn't heal on its own, and it's hard for us to get new cartilage to heal in its place or to get that flap to heal back down. There's some really neat and exciting things that are coming down the pike that have been used for the last 5 to 7 years that are really exciting, and we're very optimistic that they're going to help. And there's some other things that we can actually put into the joint to help encourage the body to grow articular cartilage. If you think you have an articular cartilage defect or a chondral defect in your knee, or you know someone who might, and you'd like to speak more about it, go to our website at honestSecondOpinion.com. Click on the direct link to scheduling and make an appointment. We'd love to speak with you and share ideas, share what's out there, compare them to your goals and expectations as far as recovery, and see if we can't get you back out there. In the meantime, be active, stay well, and we hope to hear from you soon.